Hi, I'm Nirman Bhatia. I'm one of the interventional cardiologists with Heart South Cardiovascular Group specializing in structural heart procedures. I'm going to talk about an alternative treatment option for stroke prevention in patients with atrial fibrillation or AFib. Atrial fibrillation or AFib is a very common irregular heart rhythm which can lead to formation of blood clots in the heart, most often in a small ear-like outpouching in the top left chamber of the heart called the left atrial appendage. If these clots escape from the appendage, they may travel to the brain and cause a stroke. Blood thinners such as warfarin or Coumadin, Eliquis, Xarelto, or Pradaxa are prescribed to patients with AFib to prevent these strokes. However, many patients are not good candidates for lifelong treatment with these blood thinners due to either significant bleeding complications such as gastrointestinal bleeding or nose bleeding, or high risk for bleeding such as frequent falls or balance issues. Now, there is an implant-based alternative for these patients which we are able to offer at Heart South, which is called the Watchman device. This is the only FDA-approved device currently to close off or occlude this appendage, where more than 90% of blood clots can form in patients with AFib. This device is shaped like a small parachute or a jellyfish and is about the size of a quarter. If you qualify for this device, a cardiologist can implant this device via a catheter inserted through the vein of your groin. This procedure takes about an hour, and most patients are able to go home the next day after an overnight observation in the hospital. This is a one-time procedure which allows patients to potentially come off their blood thinners as early as 45 days for the rest of their lives and offers a similar stroke prevention to warfarin without the associated bleeding complications.